Hello, everyone. I am Dr. Leslie, and I am doing something a little bit different from my usual. As you know, every Tuesday and Thursday, I do my 2-minute emergencies. But today is Monday. And why am I here today? I am here because I felt the need to discuss something that is trending right now in regards to the Johnson & Johnson vaccine. And so, in that light, I have brought a very special friend here today, and I would like to introduce Dr. Celeste. Dr. Celeste, tell us about yourself.
Hi, how's everybody doing? I'm Dr. Celeste. I'm a board certified family medicine physician specializing in urgent care. I assist busy professionals to find solutions for their healthcare needs via my concierge medicine program, telemedicine program, direct primary care, as well as my brand new Amazon bestselling Mood Vitality.
All right, thank you. And there's a special reason why I brought Dr. Celeste. Dr. Celeste does something extraordinary. And Dr. Celeste, you're outside right now. Why are you outside?
Well, if you hear the background, and I apologize in advance, we're at the Birmingham International Airport. We are running a mass vaccination site here in Birmingham. So we're doing COVID vaccines.
Oh my gosh, that is incredible. And I am so glad that you're doing that for the community.
Mm-hmm.
So, Dr. Celeste, Johnson & Johnson, they put their vaccine on pause.
Mm-hmm.
Now, a lot of people, everybody's heard about it, and there's a lot of questions that people have.
Mm-hmm.
So, most people have heard that it's because of blood clots.
Mm-hmm.
Now, when we talk about blood clots, most people think about the blood clots that are in your legs or the blood clots that make their way to your lungs.
Mm-hmm.
These clots are different, though.
Mm-hmm.
These clots are actually in the brain.
Mm-hmm.
And in the brain, they're actually in the layer between the brain and the skull, but they lead to a stroke.
Mm-hmm.
Now, the numbers say that with Johnson & Johnson, there out of 6.8 million people who were vaccinated, 6 people had this outcome.
Mm-hmm.
Now, I'm just going to look at my numbers for the math. Percentage, that literally comes down to 0.00088% of all the people that were vaccinated.
All right. Exactly.
Not a lot of people here.
Right. Mm-hmm.
So Johnson & Johnson has said that they did this. They put it on pause just to make sure that they had all the information that they needed, and they were just trying to be careful as far as all these people that are being vaccinated with it for that.
Mm-hmm. Mm-hmm.
What are your thoughts about that?
Well, I'd like to actually give Johnson & Johnson kudos for, putting it on pause themselves, doing that and taking the time to make sure, hey, let's make sure we didn't miss something. Let's make sure there's not something going on that we might not have seen in the studies that had taken place prior to that. I do think it's unfortunate what has happened with those individuals. I do know also that the particular diagnosis, which we call cerebral venous thrombosis, that is something that happens even without a vaccine in 1 in a million people in general. So if you look at the statistics, it actually follows that. Now, I do not own I don't work for anyone but myself. So there's no reason for me to feel one way about one vaccine in particular versus another. So kudos to them for taking the time out to say, hey, let's pause this for a moment, and to look and delve into it a little bit deeper. We'll just see what their studies show. What I am excited about, though, is the amount of people that we're being able to immunize in our communities to help stop this COVID pandemic. As you know, Dr. Leslie, we've been doing this now for a year.
Yeah.
The year that we've been living in a mass, not, people kind of not knowing who we are from here down. And, the vaccines have been something that is a part of our arsenal. We prayed to God and asked him for a cure.
Mhm.
And the technology that has been brought forth from both Pfizer, Moderna, and even Johnson & Johnson has been a vaccine that has been effective in helping to decrease the severity of COVID-19 infections, decreasing the spread of COVID-19 in and of itself. That data cannot be, produced. It's just straight data. It is what it is in terms of looking at the amount of cases of COVID-19 that decreased once we started vaccinating and started trying to get herd immunity throughout the country and throughout the states and even the world for that matter. So I'm encouraged by what we've been able to accomplish thus far by immunizing and vaccinating people. I know here in Birmingham at the Birmingham Shuttlesworth Airport, we're vaccinating 1,000 people a day, and we're very, very excited about making that kind of contribution to the community as it's very, very much so needed at a time wherein we're, running out of, okay, what do we do? This is a conversation you and I have had several times, Dr. Leslie, especially in the beginning stages of the pandemic, our conversations about, what was work like for you today? And, the work that you do in the emergency room, I'm urgent care, but, in the emergency room, the severity of some of the cases and some of the things that you've seen, I can just about imagine how you feel about what's going on right now in terms of what we've been able to accomplish with the vaccine. So I'm concerned for sure, as any physician would be, with what's going on with Johnson & Johnson right now, but don't feel any level of apprehension in continuing to help to immunize the community.
Absolutely, Dr. Celeste. You said so much there. And I want to go back a little bit to a lot of people right now are still on the fence, unfortunately, because of vaccine hesitancy.
Mm-hmm.
Some people feel like this is just something that's new, that's being tested, as if I've heard people say, I don't want to be a guinea pig.
Mm-hmm.
We are so far beyond that. This was not technology that was just developed
right
when COVID came to the forefront.
Precisely.
It's been worked on for years and years. It's
right.
something that they've used even in the Ebola vaccine.
Right, exactly.
It's something to treat Ebola.
Mm-hmm. Yes.
And so with old technology, they just had to make some tweaks to make it work for COVID.
Correct.
Now, we've talked a little bit about Pfizer as well as Moderna. Now, their vaccine is different from the Johnson & Johnson, which is very similar to the AstraZeneca.
Mm-hmm.
So they both use the adenovirus, which is just the common cold virus, and they use that to kind of trick your body, so to speak, not really trick your body, but teach your body how to create antibodies against the COVID-19. So AstraZeneca has also had some problems as far as these same blood clots. Now, in the US, AstraZeneca hasn't been used as much, but it's been used in Europe. So a lot of people had questions too. Okay, what's going on there? Because we do have some people who are watching here that watch Dr. Leslie that are also living in Europe.
Okay.
Now, AstraZeneca, as I said, they've had the similar problems with blood clots, but their percentages too are very, very small because they've already used it in, I believe, 78 million people.
Wow.
And with numbers this small, you're more likely, as Dr. Celeste said, to have central venous thrombosis or cerebral venous thrombosis in normal daily life. Normal people, nothing related to the vaccine.
Exactly.
So with the vaccine, they're finding it also in just a particular age group. So it's somewhere between, I believe it is age 18 and 43.
Yes.
Those 6 people, they're in that age group. And they were all women.
Right.
So part of what they're examining, they're trying to figure out is it something related to hormones, for example?
Exactly.
And
which is what most of us physician scientists would attribute that to, is that it does have a hormonal component to it. Mm-hmm.
Exactly. Now, just every day, women who are on birth control, for example, birth control is regulating your hormones. It's adding additional hormones. And so for all we know, it could be, well, these women were on hormone regulatory medications. We don't know that. So I look forward to additional research that Johnson & Johnson is doing to try to get those answers, because it's going to help not only for their vaccine, but also for AstraZeneca.
Exactly.
Right? So let's talk a little bit about, if you have gotten the vaccine, what is that time period that you need to worry about?
So the time period primarily for most of these patients that have had that reaction has been 6 to 13 days after they've received the vaccination. So those individuals that are, and at this point they paused it, so almost everyone would be out of that window. Almost everyone. I would give it another 6 days probably. Almost everyone is out of that window already. But for those individuals or patients who are like a month beyond post after getting that Johnson & Johnson vaccine, I will not say, oh, you don't need to be concerned at all. What I will say is that there have not been any reports of these incidences outside of that time frame. However, if you're someone that has received the vaccine and let's say you start getting anything that will resemble a stroke symptom, like weakness on one side of the body or the other, dizziness, headache, anything resembling a stroke, slurred speech, any of those things, you would want to seek emergency medical treatment and go to the emergency room right away. But I will tell you that if anytime any patient is exhibiting stroke symptoms, and Dr. Leslie, I know that you'll attribute to this, we're going to send them to you in the emergency room anyway, because we want them to get that CAT scan right away so that we find out if there's any bleeding there. We want to make sure that, okay, is this something going on in relation to the vaccine, or is this something that has completely nothing to do with the vaccine and could have to do with this patient's comorbidity? So just seeking emergency medical treatment is what we would recommend that person would do.
Exactly. So the only thing we're going to do a little bit differently, if we feel that, well, first of all, we need to make sure that those people, if they come to the emergency department with those symptoms, they tell us that they've just recently gotten the vaccine.
Yes, absolutely. Absolutely.
There are additional tests that we would do if that is the case, because it's not something that's found on just your regular CAT scan, but it is something that we can find out right then and there in the emergency department, and you can get treatment immediately. Now, I've had people call into the emergency department that are still so worried. They call in saying, oh my goodness, I got the Johnson & Johnson vaccine. Do I need to come to the emergency department?
Right.
Okay.
No, they don't.
No.
If you're not having, and the reason you don't want to do that, if you're not having symptoms, don't do that. If you have concerns, do telemedicine with your physician. We are now 1 year post-COVID. Well, I shouldn't say post-COVID because we're in COVID, but post-start of COVID, so that we all know the technology that exists and the ability to be able to have a consultation with your physician via telemedicine. And we definitely strongly recommend that you do that if you have questions or issues. Flooding the emergency room, if you're not having symptoms that warrant an emergency, puts more stress on the emergency medical system or that hospital system in and of itself. What you also do is you potentially expose yourself to COVID because you're going to the emergency room where people who are having breathing problems go, where people who are having chest pain go, where people are having an emergent situation. So if you're not experiencing emergency symptoms like dizziness, weakness, slurred speech, headache, severe pain, if you are feeling okay, then definitely take the option to utilize telemedicine and not put that stress on the emergency room. And you definitely don't want to put that stress also on yourself and put you or your family at risk for getting COVID if you go into that environment.
And with that light, the other thing that you can do if you have questions, you can actually go to the CDC's website and find out more information.
Exactly.
It is a great resource. It breaks everything down to you. They will give you the same information that we're giving you now.
Yes, they will.
You can take your own time. You can read it and make sure that you understand it.
Right.
Hi, Allison. Thank you so much for joining us. And thank you for saying it's great information. We appreciate that. We're just trying to get this out to make sure as many people understand what's going on as possible. So, as far as the vaccination in general, any of these vaccinations, there's a couple things that you need to make sure of before you get the vaccination. First of all, you want to make sure that everyone is aware of any allergies that you do have. You also want to make sure that you're not getting it when you have a fever, for the simple reason you don't want to get the vaccine if you actually have COVID at the same time.
Exactly.
That is a problem. All right. You want to make sure that you're not on a blood thinner or have any bleeding disorders. You want to make sure that you're not immunocompromised in some other way, or if you are, to make sure that whoever's vaccinating is aware of that. As far as pregnancy, now that was something that was a big question a while ago, but ACOG, which see if I can get this right, the American College of Obstetrics and Gynecology, they have actually said that pregnant women can receive the vaccine. Is that correct, Dr. Celeste?
That is correct. We've had several pregnant women that we vaccinated at the site. We always make sure, of course, that they've gotten a consultation or approval from their OB, as I'm not an OBGYN, neither do I want to be. I let them do their job and I stay in my lane. And so in that vein, it's up to your obstetrician to determine whether or not they feel like the COVID vaccine is appropriate for you. And so that's what we do with our patients here is we just say, hey, have you, and we've seen pregnant women of varying months of pregnancy from 5 to 6 weeks all the way up to 8 months, being 8 months pregnant, have all gotten the vaccine. And thus far, by God's grace, we've vaccinated over 12,000 people and not had any abnormal reactions or things happen with any of our patients. So we're very excited about being able to do that. But yes, we have been vaccinating pregnant women as well.
All right. And as far as I've heard, there have not been any reports of any problems to the babies once they're born.
No, I've not heard any reports of that either.
Wonderful, wonderful. And the same thing goes for breastfeeding. So you want to make sure that that's fine as well.
Right. Check with a pediatrician. You want to check with a pediatrician that is, seeing the baby to make sure that they're okay with it, because what we want to make sure is okay. We know that mom will be okay. But we want to make sure that the pediatrician is okay with the baby receiving breast milk from mom.
Exactly. All right. Now, as people are watching this, if anyone has any questions, please feel free to type it in the chat so that we can answer your questions. And as I said, we would love to share as much information as we possibly can today. So, as far as vaccine hesitancy itself, is there anything more? I mean, I've talked about this many times in the past. I've talked to different groups and different people. I am at the point where I know, well, first of all, I've received the vaccine. I received my first, I received the Pfizer vaccine, and I got my first shot in December, and I had my second in January. Now, I had absolutely zero side effects, other than the fact that my arm was sore. After all, I got a shot. Right. Now, I know other people did have fevers, chills, body aches, and that lasted for 24 hours. That was it. I have not heard about anyone having side effects that lasted longer than that period. So if you think, oh my gosh, I've heard people say, I get the flu shot and I get the flu every year, which incidentally is a fallacy. But if you get the COVID vaccination, no matter which one you get, you can have all of those symptoms, 24 hours. Think about how much better that is than having COVID itself, being hospitalized, end up in the intensive care unit, and or not make it. It'd be a fatal event for you. So that hesitancy and these vaccines are still being studied. Every single one of them is still
Right.
ongoing and studied.
Mm-hmm.
They've been proven to be safe and effective.
Mm-hmm.
Is there anything else you can tell us, Dr. Celeste, to help assure people?
Well, the one question that the last year has been a long year, you know, and the one thing that I usually am very straight with my patients and talk to them about either, and I usually try and tie it to an experience that's personal in nature to them, to get them to see the contribution that they're making to the community and to the society and their family, their work community, everywhere, if they should decide to get a vaccine. And the main thing there is that after watching, and you can attest to this, Dr. Leslie, so many people go through the anxiety, the turmoil, the stress, the anger, the frustration, the grief, just the way that COVID has misshaped all of our lives over the last year. And a lot of people have lost relatives they love. There have been young people that have died that has been unexpected, no explanation other than them having COVID-19, young people. Seeing very active, agile people that are older that have been, physically active, go from being physically active to now being bed bound and for the rest of their life, given a life sentence of a ventilator for the rest of their life because they can't get off of it. That in and of itself is such a strong force on all of us at this point, and trying to prevent that from happening again and doing everything that we can to do that is so important. Everyone does not want to live in a mask for the rest of however long, right? And so this vaccine is one of the things in our arsenal that we are hoping and praying, and that we're seeing even evidence that it's decreasing the number of COVID cases and decreasing the severity of those cases in a lot of instances. So this is a possible solution. The only issue is that for that solution, we need enough people to get the vaccine for it to be effective for what we need it to be effective for, or all of these efforts that we've made will be in vain. And I just ask people to think about that, and even if, because and a lot of the young people, especially, our young people are like, Dr. Celeste, we're not getting that vaccine. We're young, we're healthy, we didn't get sick, or, oh, I got COVID, it wasn't that bad for me. And it's until and some of it is how we phrase it to them. And you have to meet people where they are, which is why things like what you're doing right now, Dr. Leslie, going on social media, asking the questions, providing a place for your audience that follows you to find out, hey, is this something that I need to do? Or are there questions that I have? Are there questions that I can get answers to? And enough conversations like that need to happen until we make the connection enough that enough of us, at least 70% of us, get this vaccine so that we can be done with the COVID-19 pandemic. Because it started in 2019, right?
Right.
And it's 2021, guys. It's 2021. So I think that you have to meet people where they are. I think that you have to answer whatever questions they have. There's no silly question. There's no question that's off limits. I think it's just a matter of answering those questions, making sure that they understand the connection to know that, okay, if you're around your mother, because you may be okay if you get COVID, you may be, we don't know. But if your mother gets COVID, or if your grandmother gets COVID, and let's just say that you were lucky last year for the holidays and you didn't give it to her, but this year, COVID is not going to have as many hosts as it had before because there are a lot of people that are getting vaccines. But in the same vein, you still have the ability to kill your mother or your grandmother if you bring COVID to them. And the question is that worth it to you?
Exactly. I couldn't even imagine how I would feel if that happened.
Right.
I mean, and it has happened many times, unfortunately. So as Dr. Celeste said, I'm here to answer your questions. So even if you don't feel comfortable typing something in the chat right now, you can always reach me at drlesliesharp.com. Very simple. So if you have questions you just want to ask me, feel free. I'm on all social media at Dr. Leslie Sharp. So that is something easy to be one-on-one. You don't have to let anybody else know, and that's fine. And even though, as we both said, we do not work for any of these pharmaceutical companies.
Not at all.
Themselves. So anything that we say, we're trying to present you with all of the information and being as not unbiased as possible. Because it's a question in the beginning. I mean, sure, I felt like everyone else. Oh, which vaccine do I want to take? What's the difference between this one and that one? Do I have to? As an ER doc, I mean, there was no question about me being exposed. I mean, it wasn't even a question. So for me, I knew I had to get the vaccine. I was not actually required to get it. And in most places, it is still not a requirement. Some people think it's going to be in the future. I don't know. I have no idea. But as Dr. Celeste said, if 70% of the people are vaccinated, then we're more likely to get the herd immunity going. Now, here's the caveat to that. I don't want people to sit back and say, well, I'll just be the 30% that doesn't get vaccinated.
Right.
Everyone needs to take if it's your decision not to get vaccinated, that's fine, but don't do it based on somebody else will get vaccinated and I'll be covered.
Exactly.
Make sure you make your decision after you've received all of the information that you can possibly find.
Right.
That's all.
Right.
That's all. So, well, Dr. Celeste, I thank you so much for joining me here today.
You are welcome. Thank you for having me. I'm so excited. I was so excited when you called. I hardly get to do this anymore.
Part of the reason Dr. Celeste doesn't get to do this as much anymore is because, Dr. Celeste, what do you do in the media? I'm partnering, or CBS has asked me to partner with them to bring House Calls, which is a segment we do every week, every Monday morning at 6:30 a.m. We come on and have a timely, relevant, and sensitive issue that we discuss, and we answer your questions online. So send us your questions, even if we are trying to answer all the questions of our citizens here in beautiful Birmingham, Alabama. But we answer, we'll be more than happy to answer anyone's questions. And we receive those questions at housecalls@cbs42.com. Let me see if I can put something in there. So let's see.
Especially questions about, anything COVID vaccine related, anything like that. Anything that will help answer a question or relieve anxiety or help in any way in relation to COVID and what's going on.
Dr. Celeste, can you give me that once more?
Yes, it's House Calls, HOUSECALLS at cbs42.com.
All right, I'm just going to have that scrolling across the bottom here so that people can see that.
Thank you, Dr. Leslie.
Oh, my pleasure. Now remember, Dr. Celeste is in Birmingham, Alabama, but everything that we do, you can get in touch with her through her social media as well as me. And what I am, board-certified emergency physician, best-selling author, international speaker, and professional photographer. And I help bring information to you to give you that knowledge that you stay healthy, safe, and out of the emergency department. So until next time. I thank you so much, Dr. Celeste. Take care, everyone.
Thank you for having me. I enjoyed it. Thank you, Dr. Leslie. Bye, everybody.
Bye-bye.